far, we did it in June, we're September, so that's 3 months.
Exactly 90 days.
90 days, okay, good. So, yeah, thank you for coming back. And I see some of your hair growing in as compared to month 1 and 2. If the audience want to see here, you can see it's darker here. His hairline in the front grew back faster in the middle than the side, but again, you can see there's quite a bit more density here. And you can look at here too. But this is really early because on average it takes around 6 months to get some close to this. But his is a good 3 months. And again, he did medicine like Propecia, Rogaine, right?
Mm-hmm. Oral Rogaine. Oral minoxidil.
Good.
Yeah.
And then we did the A-cell injection.
Correct.
And,
yes.
And then and here, so that's where we are right now. And I'm going to show the audience what's 3 months ago looked like for him. And so this way he was, and you can see the little transformation will slowly come in. So we basically built the whole wall for him. Closer. You can see how the corner is very deep on both sides. So we give him a thick wall here. You can see how we got to rebuild the hairline here. We start from the original hairline down here and slightly curve, because otherwise his whole hairline is going to go straight up like that. So we give him that. And same thing. That's where the original hairline, so we slightly curve. He has some straggler hair here too. But otherwise, if we don't rebuild the hairline and go straight, it would look very awkward. So we give him a nice thick wall here. And so this way he is now. And so... Great. So you did mention you went on vacation recently, huh?
Went on vacation. Everything's good. Yeah.
Calgary and everything.
Yeah.
So, and can you talk to us about the, in terms of what medication helped you with the crown as well?
Yeah, so I've been getting haircuts ever since the 30-day mark. I've been getting haircuts pretty consistently, and kind of slowly kind of tapering the back. And at the beginning of September, I went down to a number 2. Which is pretty short. And my barber actually said there was no scarring, no redness, everything looked really good. And he did actually notice on top in my crown, as you can see here, it's actually getting thicker. And we think that might be from the finasteride. I'm now probably about the 3-4 month mark for finasteride. So I've gone through some shedding, but I think the hair is starting to kind of grow back and thicken in. So we've been really disciplined on the finasteride, 1 milligram a day, and then the oral minoxidil as well. So I think both have helped.
Because medication... unfortunately, it doesn't work well on the front, but it does well on the crown. And you're the great example of it.
Yeah.
If you read the package insert, they'll tell you, even for Rogaine or the pill, they tell don't even bother put it in the front for the Rogaine. And if you take the pill, you anticipate for the crown if it helps. Majority of the time, I'll be honest with you, it slow down the hair loss or it stop it. Regrowing it, it's like less than 10% of the patients who taken it.
Yeah.
So you somehow lucked out.
Yeah, I lucked out, and I will say for the audience, right, when I first met Dr. Diop in 2019, his recommendation was to get on the finasteride and come back a few years later. I didn't do that. I did come back, but if I could recommend anyway, I haven't had any side effects whatsoever. I'm really disciplined about taking it, and yeah, I may have had some regrowth, but the finasteride probably will prevent me from having, at least another transplant in the crown, maybe. Might need it down the road, but it might save me another 10 years.
At least 10 to 20 years.
Yeah.
Or maybe never. We don't know.
We don't know. We don't know.
But when I recommend the medication, I don't just recommend. Right. It's very effective.
Yes.
Yes. A lot of people are nervous about the idea of taking the medication for the rest of life, or the idea of the side effect, sexual side effect and those stuff, and. Obviously,
I've even noticed a little bit more clarity in my skin. I don't know whether that has to do with DHT levels, but don't break out as much, so could be. My barber actually noticed beard growth too. It's been a little bit better with the oral minoxidil, so yeah, I think the medication's good, and it preserves your native hair.
None of that stuff.
Yeah, none at all. No.
Yeah, so give it a try. I mean, side effects not permanent. You stop it, it's a win-win, I'll be honest with you. But it's very helpful after surgery for maintenance.
Yes.
And to prevent you from coming back. And here, our star patient here, is a great example of medication help prevent further shock loss and help regrow the crown as well.
Absolutely.
So stay tuned for next month. You're gonna see a little bit more density, but you can see the corner is darker already.
Yeah.
His front is came back so fast, and so be patient, and I'll do another filming.
Sounds good.
Okay.
Thank you.